My family's been blessed. Nobody's ever had cancer. I'm an artist. I love to draw. And I'm also an author. I'm in the process of trying to get my first novel published. August of 2020, last year, I noticed that I had some vaginal spotting. I really just thought maybe I had scratched myself or something. I didn't really take it serious. Then I started to notice I was bleeding. It was more than just spotting. So I went to see Dr. Hankey, and he ordered the vaginal ultrasound test and saw something, and he talked to me, and he said that something was growing that shouldn't be growing, and that he wanted to do a biopsy. So he scheduled the biopsy, which was done March the 5th. And by March the 16th, I got a call from him that I did have endometrial cancer.
Endometrial cancer is a common cancer in the United States. It is the fourth most common female cancer in the United States after breast, lung, and colorectal. Uterine is the fourth. There were roughly 67,000 women diagnosed with endometrial cancer in the United States last year, and roughly 12,500 women died from that malignancy last year. 90 to 95% of women that present with endometrial cancer will present with some form of bleeding irregularity. They present with changes in their bleeding patterns. So the bleeding gets heavier, they start to bleed more irregularly, things of that nature. So endometrial cancer is one of the few cancers that becomes symptomatic almost immediately with its onset. Women come in and have that evaluated, and 75% of the time, with that early presentation and diagnosis, the disease will be confined to the uterus, and they will have a very, very high rate of cure. So Ms. Dehart was a lovely woman. She's 63 years of age. She had presented to a primary care physician with complaints of postmenopausal spotting. She'd had a 5-month history of postmenopausal spotting, and she came to see her primary care doctor, who subsequently referred her to a gynecologist here at Riverside Regional Medical Center. He recognized that as a worrisome finding for the possibility of cancer. And the final pathology report from her DNC did demonstrate the presence of a grade 1 endometrial cancer. So she did have endometrial cancer. She was then referred to me by the gynecologist.
I can remember driving up to the cancer center over in Newport News by the big Riverside Hospital and just thinking, I'm going to a cancer center. Dr. Irvin is great. He walked in there, he was very encouraging, very, thorough. He took as much time as I needed to explain everything to me, and said that the best thing for me would be to have a total hysterectomy.
She did well with her surgery and was found to have a very early stage endometrial cancer, what we call a stage 1A endometrial cancer. So with robotics, we make tiny little incisions in the abdominal wall. We put trocars through those incisions, which are little hollow metal tubes. We insert instruments through those trocars, and those instruments are then attached to this incredibly complex computerized platform called the Da Vinci robot. And then once we have all that set up, I leave the patient and walk 20 feet away and sit at a console in the corner of the room, look through a little eyepiece, and I'm looking into the patient's abdomen, because one of the instruments we put into the abdomen is a camera. It's a video camera, and through that camera, sitting at the console, I can see all of the patient's organs and insides, and I control the surgical instrumentation from that console. And the advantages to the robot are, number one, you don't have the big incision, so they get better so much faster. I think Julie was very typical of women that present with endometrial cancer. She was Caucasian. She was 63 years of age. She had diabetes. She had hypertension. She presented with a 5-month history of postmenopausal bleeding. She was found to have early stage disease because she followed up on that bleeding relatively quickly, was seen and evaluated, and she has a wonderful prognosis. She should be cured.
He told me, he said, you only got a 2% chance of it coming back. He said, so I feel like you're cured.